Have you ever heard of the JN-1 virus and wondered how it affects children? Well, sit back and let's unravel this mystery together. The JN-1 virus, a name that rolls off the tongue almost as easily as it sweeps across communities, is a unique strain of virus that has baffled scientists and medical professionals alike. Unlike the viruses we're familiar with, this one didn't originate from animals or a mutation, but rather from a place we least expected: our very own water systems. That's right, folks. This elusive virus spreads through contaminated water, making it a silent invader in our homes and schools. Now you might be thinking, we've dealt with waterborne diseases before. What makes this JN-1 virus any different? Well, that's a great question. The JN-1 virus stands apart from other common viruses in its astoundingly rapid rate of infection. It's like a wildfire, except it's invisible and in your water supply. Another striking difference is its resilience. This virus seems to have a knack for survival, resisting our usual methods of water disinfection. It's like that stubborn stain on your favorite shirt that just won't go away no matter what you try. But here's the kicker. The JN-1 virus has a peculiar predilection for children. It's not that adults are immune, but rather, kids seem to be more susceptible to the virus. This has led to a surge in JN-1 virus cases among our young ones, making it an urgent matter that needs our collective attention. So we've got a rapidly spreading, resilient virus that has a special affinity for children. Sounds like the plot of a sci-fi movie, doesn't it? But it's not. It's our reality, and we need to confront it head-on. Understanding the JN-1 virus is the first step towards safeguarding our children's health. And that's exactly what we're here to do, to understand and arm ourselves with knowledge, because knowledge, after all, is power. Stay tuned for more on this intriguing virus and how we can protect our little ones from it. The JN-1 virus manifests itself in ways that are sometimes hard to distinguish from common illnesses. This can make it particularly tricky to identify, especially in children. The first symptom to be aware of is a high fever. Unlike the typical low-grade fever that might accompany a common cold, the fever associated with the JN-1 virus tends to be significantly higher and lasts longer. It's not just a day or two of feeling warm, it's a persistent, high-grade fever that doesn't seem to break. Next, there's a distinct rash that appears on the skin. It's usually red, blotchy, and can be itchy. This isn't your average rash. It's more widespread, covering large areas of the body, and it doesn't go away with your usual over-the-counter creams or lotions. Then there's the fatigue. Children infected with the JN-1 virus often feel extremely tired, more so than what you'd expect from a typical bout of the flu. They may sleep for extended periods, lack energy for their usual activities, and overall, just seem not themselves. In addition, children may experience severe headaches and muscle aches, making it difficult for them to move around or engage in play. They might complain about a constant throbbing pain in their head or say that their body hurts. Lastly, the JN-1 virus can cause significant stomach upset, leading to vomiting and diarrhea. This isn't your usual upset tummy from eating too much candy. It's persistent and can lead to dehydration if not properly managed. Now, it's important to remember that children may not experience all of these symptoms, or they may experience them in a different order. Some children may have mild symptoms, while others may have more severe symptoms. It's also worth noting that symptoms in children can be different from those in adults. For example, adults may experience more respiratory symptoms, such as a persistent cough or difficulty breathing. Recognizing these symptoms early can be key to providing your child with the necessary care and treatment. If your child is exhibiting any of these symptoms, it's important to seek medical attention immediately. The JN-1 virus can have serious implications on a child's health. In the short term, kids infected with the JN-1 virus may experience a range of symptoms. These can be as mild as a common cold or as severe as a high fever and respiratory distress. The virus, as we've seen, has a knack for unpredictability, with symptoms varying greatly from child to child. It's this unpredictable nature that makes the JN-1 virus a cause for concern. Children in particular can be vulnerable due to their developing immune systems. In some instances, the virus can lead to complications like pneumonia or bronchitis, which require immediate medical attention. Additionally, the JN-1 virus can exacerbate existing health conditions in children such as asthma or diabetes, making their management more challenging. But the impact of the JN-1 virus doesn't stop at short-term effects. the virus can also have long-term implications on a child's health. Studies indicate that children who have contracted the virus may face challenges with their lung function and overall growth. There's also evidence to suggest a potential impact on a child's cognitive development and mental health, but more research is needed to fully understand these effects. The good news is that early intervention can make a world of difference. Recognizing the symptoms early on and seeking medical advice can help manage the virus and prevent complications. And while there's no specific cure for the JN-1 virus, treatments can help alleviate symptoms and support the child's recovery. Prevention, too, is crucial. Good hygiene practices, a balanced diet, and regular exercise can all contribute to boosting a child's immunity, helping them ward off viruses like JN-1. Vaccination, where available, is another powerful tool in our arsenal against the virus. Remember, every child is unique, and the way they respond to the virus can vary. Regular checkups and open communication with healthcare providers can go a long way in ensuring your child's well-being. When it comes to the JN-1 virus, prevention and early detection are our best weapons. It's crucial to keep in mind the important points about the JN-1 virus in children. This virus, shrouded in mystery, is an invisible foe we're striving to understand. It manifests itself through a range of symptoms, some common, like fever and cough, others more unusual, like rashes or unexpected fatigue. The impact on children is significant. While they often exhibit milder symptoms compared to adults, the virus can disrupt their usual routines, causing distress and discomfort. It's also worth noting that children can be silent carriers, unknowingly spreading the virus to others, including those who might be more vulnerable. Remember, knowledge is power. Understanding the basics of the JN-1 virus, recognizing its symptoms, and appreciating its impact on children is our first line of defense. It's our responsibility to stay informed and vigilant. Armed with this knowledge, we can help protect our children from the JN-1 virus and ensure their well-being.